It starts like any normal day. You're sipping tea, reading the paper, when your arm suddenly goes numb. You try to speak, but the words don't come out right, and you're alone. No one's around to help. For thousands of seniors every year, this is not just a fear, it's their reality. The biggest mistake, thinking it'll pass or not knowing the first step to take. That hesitation, even for a few minutes, can mean permanent brain damage or worse. But here's the truth. You don't need to be helpless. In this video, we'll walk through everything you need to know to survive a stroke when you're alone. From the earliest warning signs that many seniors overlook to how to use your phone or even your smart speaker to call for help, even if you can't talk. We'll explain how to make your home safer so paramedics can reach you faster, the safest position to lie down during an attack, and why eating or drinking can actually make things worse. You'll also learn how to track symptoms for doctors using nothing but your phone, how to spot a mini-stroke before a major one hits, and how to create simple emergency reflex habits that could save your life. We even share a powerful real-life story from a senior named Mary, who recognized the signs, acted fast, and lived to tell about it. Whether you live alone or have aging parents who do, this is a conversation we all need. Because when it comes to stroke, what you know and what you're prepared to do can be the difference between life and loss. And that preparation starts now. You know, a lot of people think the most dangerous place to have a stroke is out in public, maybe while driving or walking across a parking lot. But the truth is, for older adults over 60, the riskiest place might be your own living room. Why? Because that's where many seniors spend most of their time, often alone, relaxed, thinking everything is okay, until it's not. Imagine you're home, just finishing lunch or watching a bit of TV, and you feel a strange wave of dizziness wash over you. One arm starts to feel heavy, almost like you slept on it wrong, and your mouth doesn't seem to move quite right when you speak. It doesn't feel like an emergency at first, it feels like a fluke. And because there's no one there to witness it, many people ignore it, hoping it'll pass. That's the most dangerous moment. You see, stroke is one of those conditions where minutes really do matter. The faster someone acts, the more brain function they can save. But when you're alone, that reaction time almost always gets delayed by confusion, fear, or just not knowing what to do. The American Stroke Association has shown that 1 in 4 stroke victims are people over 60 who were home alone when it happened. It's even more alarming when you realize that a good number of those people didn't recognize the symptoms early enough to get help in time. And this isn't about blame. It's about how easy it is to misread the signals. A little numbness in the fingers, maybe arthritis, a headache, could just be dehydration. But what many don't realize is that stroke symptoms can be very mild at the start. Just a little slurred speech or a brief spell of confusion. That's why education is so powerful. Knowing that these little things could actually be early signs of a bigger problem can change how you respond. For those of us over 60, especially those managing high blood pressure, diabetes, or sleep issues, the risk increases. Stroke doesn't just hit without warning. It often builds quietly in bodies already carrying inflammation or wear from decades of stress. Living alone brings with it a certain peace and independence, but it also means there may not be someone nearby to notice if one side of your face starts drooping, or if you suddenly can't lift your arm. And that's what makes this such a serious issue. It's not just the stroke itself, it's the delay. It's the 10 minutes you spend thinking, maybe I'll feel better if I just sit down instead of calling 911. It's the hesitation to disturb someone or the fear of making a fuss. And during that hesitation, your brain may be losing millions of cells. That's why this video exists, to walk through everything from early signs to reflex drills so you can be ready. Because waiting for someone else to notice won't help if you're alone. And setting up systems in your home that help you respond faster, like voice-activated medical alerts or emergency contacts saved into your phone, can bridge that dangerous gap between the moment symptoms start and when help arrives. It's not just about surviving a stroke. It's about surviving it in a way that lets you recover well. Many people who get fast treatment are walking and talking again just days later. Others who waited too long never regain the ability to speak clearly or move their limbs. That difference often comes down to seconds, not hours. And those seconds are harder to manage when you're on your own. But being alone doesn't have to mean being unprepared. You can have tools, routines, and knowledge that guide you through those first crucial moments. And it all starts with understanding why your living room, your bedroom, your kitchen, these places you feel safest, can sometimes become the most dangerous if you don't recognize the warning signs. Over the next sections, we'll explore exactly how to spot these signs, how to react, and what small daily habits can make a huge difference. But first, let's take a closer look at the early symptoms most people overlook. Because when it comes to surviving a stroke alone, the very first battle is recognizing it in time. Sometimes the body whispers before it screams. And when it comes to stroke, those whispers are often ignored, misunderstood, or brushed off as just one of those days. For many people over 60, small signs appear long before the full stroke hits, but they feel too mild or strange to take seriously. That's where the real danger begins. A sudden wave of confusion while standing in your kitchen, forgetting what you were about to grab from the fridge. A moment when your vision blurs, but you assume your glasses need cleaning. A sharp, sudden headache that's not like your usual ones. Many seniors don't connect these moments to stroke at all. They assume it's fatigue, dehydration, or just aging. But these are red flags. They're the quiet signals your brain sends out when blood flow is being disrupted, even if only for a few minutes. Doctors call this a TIA, a transient ischemic attack. You may have heard it called a mini stroke. It feels temporary because the symptoms fade within an hour, often within minutes. But make no mistake, a TIA is a full warning shot. Studies show that 1/3 of people who have a TIA will go on to have a major stroke within a year if nothing changes. And that's why paying attention matters so much. These early signs can vary. You might feel weakness or tingling in one hand. You might notice that your words aren't coming out right. Not slurred exactly, but just harder to form. You may feel dizzy, lightheaded, or off balance when standing up, but it's not from low blood sugar or poor sleep. And then there's the emotional reaction. Some seniors say they suddenly felt afraid for no reason or had a sense that something was off, even before the physical signs started. That gut feeling is worth respecting. Many times, our bodies know when something serious is brewing, even before our minds catch up. Stroke is not always loud. It doesn't always drop you to the ground. For people over 60, especially those dealing with inflammation, high blood pressure, or sleep disruption, it often starts with these silent signals. And when you live alone, no one's there to see them but you. That's why awareness is the key. Learning to connect a strange sensation to the possibility of a stroke gives you back your power. It means that moment when your hand feels weaker than usual isn't dismissed. It becomes a reason to pause, assess, and prepare. One of the most overlooked warning signs is a sudden change in vision, especially in just one eye. Could be blurred, doubled, or briefly lost altogether. Another is sudden difficulty understanding speech or putting words together. It's not memory loss. It's a moment where your brain is struggling to connect thought and language. And then there's fatigue, not just being tired, but feeling like your limbs are heavier than usual or that your head feels foggy in a strange way. These moments often happen in the hours or even days before a major stroke. And here's where stroke prevention truly begins. Not after it happens, but right here, when the body starts to nudge you gently with early symptoms. Recognizing these cues can mean the difference between reaching help in time and falling into a critical delay. And it's not about panic, it's about clarity. Many seniors feel embarrassed calling 911 if symptoms go away quickly. But emergency teams would rather check on you 10 times with no issue than miss the one time it was a stroke. If you've ever experienced any of these strange moments, tingling in the fingers, sudden imbalance, unexplained headaches, it may be time to look back and think, were those just random, or were they gentle warnings you didn't fully understand at the time? That kind of reflection helps prepare you for the future. And from this point forward, whenever something like that happens, you'll know what to do. Now that we've uncovered these subtle but serious signals, let's move forward and learn how to check yourself when no one else is around, because your own reflection might just reveal the next sign before it's too late. There's something deeply comforting about our daily routines. Waking up, brushing our teeth, glancing in the mirror without much thought. But for those over 60, that mirror might quietly become one of the most important tools in your home. Because in the first few seconds of a stroke, your own reflection can help you spot the warning signs, if you know what to look for. Many people think of stroke symptoms as extreme: collapsing to the floor, complete paralysis, slurred speech so obvious it stops the conversation. But often they begin more gently. And if you're alone, there's no one to tell you your smile looks off or your words sound unclear. That's why the mirror test is so powerful. It gives you a second opinion without needing someone else in the room. Here's what many doctors recommend. When something doesn't feel quite right, maybe you feel dizzy, lightheaded, or you're having trouble forming words, go straight to a mirror and look at your face. Try smiling. Does one side of your mouth stay flat while the other lifts? That's a major red flag. Now raise both arms. If one drifts downward or feels too weak to stay lifted, your body is trying to tell you something serious. These two movements, your face and your arms, can reveal muscle weakness that's often invisible to the person experiencing it, especially if the stroke is affecting the part of the brain responsible for awareness. And if you're unsure about your voice, speak out loud. Say a simple sentence like, "Today is a beautiful day," and listen carefully. Is your speech slurred, slow, or hard to understand? So don't wait. Time is now critical. These three signs, facial drooping, arm weakness, and slurred speech, are the core of what's called the FAST test. F for face, A for arms, S for speech, and T for time. But when you're alone, the key is to use that mirror to do the checking yourself. It's simple, it's free, and it only takes seconds. For someone living with high blood pressure, blood sugar swings, or a history of inflammation, doing this check during moments of dizziness or confusion could be life-saving. It's also wise to make the mirror easily accessible. Keep one at eye level in common areas, not just the bathroom, so you don't have to walk far or search if something feels off. And remember, strokes can affect vision as well. If you notice that your eyes look unfocused or one eyelid is drooping more than usual, that's another warning. These aren't beauty details, they're neurological clues. And while mirrors can't diagnose, they give you the evidence you need to take action fast. For many older adults who live alone, this quick self-check has led them to call 911 at the perfect time, early enough for emergency treatment to work. Because certain stroke medications, like clot busters, can only be given within a few hours of symptom onset. That window closes quickly, but it opens with awareness. It opens with that moment of looking in the mirror and trusting what you see. And if you've practiced this test even once during a calm moment, it becomes easier to do when stress or panic sets in. It's like a mental reflex. You don't have to think, you just go to the mirror and check. That habit alone might save your life. Next, let's dive deeper into why the basic fast test isn't always enough, and how some lesser-known symptoms can still signal a stroke, even if your mirror shows no obvious change. By now, most people have heard about the fast test: face, arms, speech, and time. It's a simple and powerful tool. But what many seniors don't realize is that strokes don't always follow the fast rule. Sometimes, the signs are quieter, stranger, and easier to miss, especially when you're over 60 and living alone. That's where real danger hides. You might not see a drooping face or feel weakness in your arm, but that doesn't mean your brain isn't in trouble. In fact, some of the most overlooked stroke symptoms are the ones that don't seem connected to stroke at all. One of the most common and most ignored is sudden confusion. You're doing a normal task, like making coffee or reading a recipe, and suddenly nothing makes sense. You can't follow the steps. You forget what you were doing. For many older adults, that moment of disorientation feels like a senior moment, but it could actually be a stroke. Another symptom doctors often mention is trouble with vision. This isn't about needing stronger glasses. This is about sudden, strange changes, like seeing double, losing sight in one eye, or having a dark curtain fall over your field of vision. And here's the tricky part. These visual issues might last just a few minutes. Then they disappear. That's exactly why people brush them off. But those brief episodes could be mini strokes or early signs of reduced blood flow in the brain. Then there's the headache, not your usual kind, not from stress or tension. This one comes on fast, often in seconds, and feels different, sharper, deeper, maybe even electric. If you've had migraines before, this won't feel the same. Many stroke survivors say it's the worst headache of their life, or just off in a way they can't explain. And if that pain is joined by dizziness or nausea, it becomes an even stronger warning. Dizziness alone can also be a red flag, especially when it comes out of nowhere. You stand up and the room tilts, or you're sitting still and suddenly feel like you're on a boat. These sensations, when not linked to dehydration or low blood sugar, should never be ignored, especially if they're paired with imbalance, clumsy movement, or a sudden fall. Many strokes start in the brain's coordination centers, not the areas controlling the face or arms. That's why relying on fast alone isn't always enough. Older adults with pre-existing conditions, high blood pressure, sleep apnea, blood circulation issues, are even more likely to have unusual stroke symptoms. And here's a less talked about one: numbness in strange places. A hand that feels like it's fallen asleep but doesn't wake up. A leg that tingles all of a sudden. Or a patch of your face that feels cold or heavy. These sensations may seem mild, but they can mark the beginning of a serious stroke. What's especially dangerous is that many seniors are used to some level of discomfort, sore joints, tired eyes, foggy thinking. So when stroke symptoms show up quietly, they blend in. They get chalked up to aging or skipped medication. That's why doctors now urge older patients to pay attention to any new or different feeling, especially if it comes on fast and affects just one side of the body. And if multiple strange symptoms appear at once, even if they're subtle, it's even more urgent. Imagine your speech feels a little slow and your balance feels off. That's not coincidence. That's your brain calling for help. One more thing to note. Some people experience sudden emotional changes right before or during a stroke. You may feel a wave of fear, anxiety, or sadness without knowing why. Or you may feel numb emotionally, like you've checked out. This isn't just mood, it's neurological. The stroke could be affecting areas of the brain responsible for emotion. So when we say listen to your body, we mean listen to all of it, what you feel, what you don't feel, and what feels unusual. These lesser-known stroke signs, vision trouble, confusion, sudden headache, imbalance, numbness, might not be part of the fast checklist, but they matter just as much. Recognizing them early could give you precious minutes to act. And those minutes save brain cells, they save speech, they save movement, they save independence. Coming up, we'll talk about a situation that's especially tricky when stroke happens while you're asleep, because it's not as rare as people think. And waking up with certain symptoms might mean the stroke already started hours ago. For many seniors, the morning is a peaceful time, a fresh start, a slow stretch, maybe a warm cup of coffee before the day begins. But what if one morning you woke up and something didn't feel right? Maybe your arm was oddly numb, or your leg felt stiff and hard to move. Maybe your mouth felt strange when you yawned, or one side of your face didn't seem to wake up with the rest of you. These small, quiet signs might not seem urgent. Many people assume they just slept in the wrong position or that their arthritis is acting up again. But in reality, what you're experiencing could be the aftermath of something far more serious. A stroke that began while you were asleep. Yes, strokes can happen during the night, and they often do. They're called wake-up strokes, and they're more common than most people realize, especially in seniors dealing with conditions like high blood pressure, sleep apnea, poor circulation, or chronic inflammation. The danger with these strokes is that they often go unnoticed until you open your eyes. And by the time you realize something is wrong, the treatment window may already be closing. You see, for many stroke therapies, especially clot-busting medications, timing is everything. They work best when given within 3 to 4.5 hours from the first symptom. But if the stroke started at 2 a.m. and you wake up at 7 a.m., it's already been 5 hours, and doctors can't always be sure when exactly the symptoms began. That uncertainty can make it harder to receive aggressive treatment. That's why it's so important to notice even the smallest changes in your body the moment you wake up. Stroke during sleep doesn't always cause pain or dramatic symptoms. Instead, it might leave you with weakness in one arm or leg, slurred or slower speech when you try to talk, or a strange heaviness in half your face. Some people describe it as feeling like one side of their body didn't join them when they got out of bed. If you've ever woken up and your foot wouldn't cooperate when walking to the bathroom, or your coffee cup felt harder to grip with one hand, it's worth paying attention. And don't ignore it just because the symptoms seem to fade. Sometimes, strokes cause damage that your brain temporarily works around until it can't. That's how small, silent strokes can lead to big ones later. One of the biggest mistakes people make is waiting to see how it feels later or taking a nap to shake off the discomfort. But when it comes to stroke, waiting can cost you your independence or your life. If you wake up and something feels off, especially if it's one-sided, unusual and sudden, don't dismiss it. Call for help. Get checked. It's better to be safe and find out it was a pinched nerve than to wait and miss the chance for life-saving treatment. And if you're someone who lives alone, this becomes even more important. You're the only one who can notice if your face doesn't look quite right in the mirror or if your speech feels just a little too slow. Keep a small checklist by your bedside, a mental or written one. Ask yourself each morning, do I feel balanced? Can I lift both arms evenly? Is my speech clear when I say a full sentence out loud? Do both sides of my face move the same when I smile or yawn? These questions take less than 30 seconds, but they can alert you to a silent stroke that happened while you slept. And over time, building that morning habit can give you confidence, not fear. It's a way to take control even when you're vulnerable. Another helpful step is to set up your environment in case something happens while you're sleeping. Keep your phone within reach and enable emergency voice commands like "Hey Siri," call 911. Wear a medical alert device that can be triggered by voice or touch. You can also talk to neighbors or family members about a morning check-in system. A simple text or voice message once a day that says, "I'm up and okay." These aren't signs of weakness. They're signs of wisdom, because being alone doesn't have to mean being unprotected. Many stroke survivors say their wake-up stroke didn't feel like a disaster. It felt like a slow realization that something was off. And the ones who got help early often recovered better. The ones who waited lost valuable time. That's why understanding how strokes can happen quietly, even while you sleep, gives you one more good heart health. And there are several empowers you to act, not guess. And in the next section, we'll talk about exactly what to do the moment you suspect something's wrong. Because what happens in those first 3 minutes could change everything. The moment you sense something is wrong, whether it's a heavy arm, a drooping mouth, or a sudden wave of confusion, those first 3 minutes are the most critical. Not 3 hours, not 30 minutes, just 3. Because in those 3 minutes, the decisions you make will shape everything that follows. Whether you'll walk again, talk again, and live independently, or whether your life will change in ways you never expected. Many seniors over 60 don't realize how time-sensitive stroke treatment really is. There's a phrase that stroke specialists use every day: time is brain. For every minute a stroke goes untreated, nearly 2 million brain cells can die. That's why the fastest action possible is the most life-saving action. The very first thing is simple: acknowledge the signs. Don't second-guess yourself or brush it off as tiredness or age. If your arm won't lift, if your face feels uneven, or your words come out strange, say it out loud. This could be a stroke. Naming it helps you take it seriously. The second thing, and this cannot be stressed enough, is call emergency services immediately. Not later, not after you drink water or lie down. Right now. Many older adults try to wait it out, especially if they're alone, thinking they don't want to be a burden or make a fuss. But that wait is what causes permanent damage. Dial 911 the moment you feel something is wrong. If your speech is slurred or weak, just say the word stroke. Dispatchers are trained to recognize it, even if your words aren't perfect. And if you can't speak at all, don't hang up. Your call can still be traced, and emergency teams can be sent to your location using your phone signal. That's why it's so important to keep your phone charged and within arm's reach, especially overnight or when you're home alone. You can also activate voice-controlled emergency calls on most smartphones. Saying, "Hey Siri, call 911" or "OK Google." Call emergency can work even when you can't physically unlock the screen. But let's say you're struggling with both speech and movement. That's where preparation makes all the difference. Many seniors now use medical alert devices, which can be triggered by voice, tapping, or even motion sensors. Others keep a small button device around their neck or wrist that connects them directly to a help center. These aren't just gadgets, they're lifelines. And using them in those first 3 minutes can completely change the outcome of a stroke. If you don't have one yet, it's something to seriously consider. Because it's not just about reacting, it's about making it easier to react when your body doesn't cooperate. The third part of this critical window is mental clarity. Once help is on the way, do everything you can to stay calm. Panic raises blood pressure, which can make a stroke worse. Try to breathe deeply, slowly, and evenly. Focus on staying still. Don't walk around. Don't go searching for things or trying to lie down in a different room. Movement increases the risk of falling, especially if your balance is affected. If you can sit or lie in a safe, open spot where paramedics can easily find you. Turn on a light if it's dark. If you're near the front door, unlock it or leave it ajar. Every second counts. Many people ask, should I take an aspirin? And the answer is, only if a doctor has told you to do so in advance. Some strokes are caused by bleeding in the brain, not clots, and aspirin can make them worse. So unless you've been instructed to take aspirin at the first sign of symptoms, don't take anything. Just focus on getting help. For those with chronic conditions like high blood pressure, diabetes, or heart disease, it's also smart to keep a written list of your medications, allergies, and emergency contacts in a place paramedics can easily find, like on the fridge, near your bed, or stored in a small pouch by the door. If you have enough presence of mind in those first few minutes, you can even tell the dispatcher where this information is located, so responders are fully prepared when they arrive. Now, remember, the 3-minute window doesn't mean you only have 3 minutes to survive. It means you only have 3 minutes to act before the damage starts to build. Some people delay action because they feel embarrassed. Others think they'll be fine in a few hours. But every senior needs to understand this. The earlier you act, the better the chance you'll get clot-busting treatment that restores blood flow and prevents long-term disability. Those first 3 minutes are your moment of power. They're the chance to protect your brain, your speech, your ability to hug your grandkids, walk in the garden, or hold a cup of tea without spilling. And the beautiful thing is, it doesn't take special training or high-tech tools. It just takes one decision. Don't wait. Coming up, we'll explore exactly how to call for help, even if your voice isn't working, so that even in the worst moment, you're never truly alone. Imagine this, you know something is wrong. You can feel it. One arm is weak, your face feels odd, and worst of all, you open your mouth to call for help. But the words won't come. They're trapped somewhere between your brain and your tongue. For many seniors, especially during a stroke, this is one of the most terrifying moments. You're aware, you know you need help, but your ability to speak has been affected. And when you live alone, it can feel like your lifeline has been cut. But here's the truth. Even without speaking, there are still powerful ways to get help, and they can be set up before anything ever goes wrong. Let's start with your phone. Most modern smartphones have built-in emergency features that work without needing to say a word. If you're using an iPhone, you can press the side button 5 times quickly. On many Android phones, the same can be done by holding the power button and selecting emergency mode. These shortcuts activate a loud alarm and automatically dial 911, often sending your location to emergency services at the same time. No speech required. Some phones even allow you to pre-program emergency texts that are sent out to family members or neighbors with just one touch. These messages can say, "I need help," "I may be having a stroke," and include your GPS location. For seniors over 60, especially those managing conditions like high blood pressure, inflammation, or previous TIA episodes, activating and practicing these emergency features is not just helpful, it's critical. Voice assistance can also be your ally. If your voice is weak but still functioning, saying, "Hey Siri, call 911," or "OK Google," emergency may trigger a call, even if it's not fully clear. These systems are designed to catch certain trigger phrases and can understand slurred or soft speech better than you might think. But what if your voice is completely gone? That's where hands-free tools come in. Wearable devices like a medical alert bracelet or pendant can be pressed to instantly notify emergency contacts or connect you to a 24/7 support center. Some devices even detect sudden changes in movement or fall patterns and alert someone on your behalf. And the technology is only getting smarter. Motion sensors, smartwatches, and even home hubs can play a vital role in keeping you connected when your body can't respond the way it used to. Let's say you're sitting near your smart speaker. Devices like Amazon Echo or Google Home can be set up in advance to make emergency calls or send alerts when you say certain phrases. You might set a command like "Help Me" or "Emergency Mode" that triggers a series of actions. Turning on lights, contacting your daughter, and calling 911. Practicing those commands out loud once a month might feel silly, but when the real moment comes, your body remembers what to do. Even beyond technology, think about building simple backup systems into your daily life. Leave a note or sign in common areas like the fridge or near the phone with basic instructions. Press this button, say this word, tap this screen. These reminders may seem small, but they become incredibly helpful when your brain is moving slowly or your speech is failing. And don't overlook the power of your neighbors. Some seniors set up an emergency signal system, maybe knocking 3 times on a shift shared wall or leaving a light on during specific hours. If you trust someone nearby, that small routine can mean everything in an emergency. You may even consider installing an indoor camera with voice access, so a family member can check in and respond if something doesn't look or sound right. What matters most is that you don't rely on just one method. Create layers, voice commands, physical buttons, motion detection, emergency contacts. These layers ensure that even if one part fails, another kicks in. Think of it like building a safety net around your home. And once it's in place, you don't have to worry about being voiceless during a crisis, because your environment is trained to speak for you. Most importantly, don't wait until a stroke happens to figure this all out. Spend a quiet afternoon setting up these systems. Test your emergency call shortcut. Program your medical info into your phone. Practice saying "help me" to your smart speaker, because if that moment ever comes and you can't say a word, everything you've prepared will speak volumes. Next, we'll look at how to use simple home technology and smart devices to make sure help is always just a moment away, no matter the hour or your condition. Technology isn't just for the young anymore. It's quickly becoming one of the most important allies for older adults, especially those living alone. And when it comes to stroke emergencies, the right tech setup in your home can make the difference between fast recovery and lifelong disability. It's not about complicated gadgets or confusing apps. It's about using simple, familiar tools in a smarter way. Let's start with something many seniors already have: a smartphone. This little device in your pocket is much more than a way to make calls. When configured properly, it becomes your 24/7 emergency responder. Most smartphones, both iPhone and Android, have built-in medical ID features that can be accessed even from a lock screen. That means if paramedics arrive and you're unable to speak, they can still see your name, medical conditions like high blood pressure or diabetes, current medications, allergies, and your emergency contacts. You can set this up in less than 10 minutes. It's one of the easiest ways to prepare for a stroke emergency when time is short and every second counts. Another valuable feature is the emergency SOS shortcut. On an iPhone, you can press the side button 5 times quickly, and it will automatically call 911 and alert your emergency contacts with your location. On Android, a similar function exists, often triggered by holding down the power button and tapping emergency. For people over 60, especially those with mobility or speech issues, these shortcuts are a must-have. And then there are smart speakers, devices like Amazon Echo or Google Home. These can be programmed to make emergency calls with a voice command like Alexa, call for help. Some systems can even send alerts to loved ones or trigger smart home functions like turning on the lights, unlocking a smart door, or broadcasting your voice through all speakers in the house. This becomes incredibly useful at night or if you fall and can't reach your phone. A few words can activate your entire support system. Wearable devices are another smart layer of protection. Medical alert pendants, smartwatches with fall detection, or even fitness bands that track heart rate and oxygen levels can all help detect when something's wrong before you even realize it. Some devices automatically call for help if you fall and don't move within a certain time frame. Others can monitor patterns over weeks and alert you or your doctor if something seems unusual. If you're dealing with health conditions like chronic inflammation, irregular heartbeat, or blood pressure issues, this kind of passive monitoring can serve as an early warning system. Smart home tools like motion sensors, pressure mats under the bed, or automatic light timers also help create a safer environment. For instance, if a motion sensor doesn't detect movement during your usual morning routine, it can trigger a message to a caregiver or family member. It may sound high-tech, but many of these systems are designed for ease of use, and you don't need to install everything at once. Start simple. Even one or two of these tools can give you peace of mind. For example, just setting a daily voice reminder reminder through your smart speaker to check your balance and arm strength each morning can build a healthy habit that helps catch early signs of stroke. And beyond devices, think about connectivity. Make sure your Wi-Fi is reliable, your phone is always charged, and you have a plan in place for power outages. A backup battery for your phone or a portable hotspot can keep your safety net working even when the lights go out. Technology can feel overwhelming at first, but it's really about one thing, giving you control when your body can't. It's not just for emergencies either. It creates daily structure, builds confidence, and helps you stay independent longer. Some people say, well, I've never needed any of that. But stroke doesn't give warnings. It strikes fast, and the body you've trusted for years may not cooperate when you need it most. Setting these tools up in advance means you won't be scrambling in a crisis. You've already done the thinking. Your environment is ready to protect you. You don't have to fear being alone because your home becomes your partner. And even if you never need to use it, just knowing it's there can bring a sense of calm, both for you and for the people who care about you. In the next part, we'll shift from technology to preparation. How to make your home easier for emergency responders to enter quickly, so they don't lose precious minutes when it matters most. When stroke hits, every single minute becomes precious. And if you've already called for help, you might think the hardest part is over. But there's one more critical piece that often gets overlooked: making sure emergency responders can actually get to you without delay. It may sound simple, but for many seniors living alone, this is where valuable time gets lost. Picture this: you've managed to call 911. You're inside your home, scared, confused, maybe already feeling weak on one side. The paramedics arrive, but the door is locked, your building has multiple security gates, and you're in the back bedroom with no way to move. They can't reach you. Those few extra minutes spent figuring out how to get inside could be the minutes your brain needed to be safe. So what can you do, starting today, to make sure your home doesn't become a barrier when every second matters? The first and most important step is simple. If you're still able to move when symptoms start, unlock your door. Even if you don't think help will arrive right away, do it first. Paramedics often face locked doors and tight entryways, especially in senior apartment complexes. And if you live in a building with multiple entrances, make sure you're positioned near the one they'll come through. Turn on exterior lights if it's dark, porch lights, hallway lamps, anything that helps emergency crews identify your home quickly. For houses with long driveways or back entrances, leaving a small sign or reflective number plate can make a huge difference. But what if you can't move? That's where preparation comes in. Consider installing a key lockbox outside your door and share the code with trusted family, neighbors, or even the local emergency dispatch if your community supports it. Some seniors also use smart locks that can be opened remotely by a caregiver or family member if needed. If your building has a front desk or concierge, give them written permission to allow emergency responders in without delay. It's a small form to fill out, but in an emergency, it can bypass long phone calls and permissions. Keep your home well lit and clutter-free in the areas near entrances and hallways. Paramedics may need to bring in stretchers or move equipment quickly. Narrow walkways or tripping hazards can slow them down or even create more risk for you. Keep important health information posted somewhere visible. The refrigerator door is a common and effective spot. Include a printed list with your full name, date of birth, medications, allergies, chronic conditions like high blood pressure or diabetes, and the contact information of your closest emergency support person. If you have a pet, note it on the sheet too. Many responders appreciate knowing if a dog or cat is in the home, especially if it might run out or hide. Another smart step is creating what some caregivers call a go zone, a spot near the front of your home where you place essentials in case of an emergency. That could be a folder with your medical info, a small overnight bag with a change of clothes, phone charger, ID card, and copies of insurance information. This area becomes your towards
safety
maintaining
hub.
good heart health.
If you're
And
ever
there are
able to
several
move during a
levels is
stroke
a key
event,
step towards
aim to
maintaining
get to
good
that
heart
spot.
health. And
It
there are
gives first
several levels is
responders
a key
everything
step
they
towards
need in one
maintaining good
place.
heart health.
And
And there
finally,
are
prepare your
several
loved
levels is a
ones.
key step
Let them
towards
know how to
maintaining good
access your
heart health.
home if
And
something
there are
happens
several
and you're not
levels is a key
responding.
step towards
Share your
maintaining good
lockbox
heart
code.
health. And there
Walk
are
them through your
several
home
levels is a
layout.
key step
Create a
towards
routine where
maintaining
you
good
check
heart
in
health.
with a short
And there are
text or phone
several
call
levels is a
at a
key
regular
step
time
towards
each day.
maintaining good heart
If you miss
health.
a check-in,
And there are
they'll know to
several
call
levels is
or
a
stop
key
by.
step towards
These
maintaining
systems
good
aren't
heart
about
health.
fear,
And
they're
there are
about
several
readiness.
levels is a key
Most people
step
over
towards
60 don't
maintaining
think
good
about
heart
how
health. And there are
inaccessible their
several
homes may
levels
be
is a
during an
key step
emergency
towards
until it's
maintaining
too
good
late.
heart health.
But
And
stroke
there are
doesn't give you
several
time
levels
to
is a
think
key
or
step
prepare
towards
in the moment.
maintaining good heart
It
health.
asks you to
And there are
already be ready.
several levels is a
Think of
key
it like
step
fire
towards
safety
maintaining good
drills.
heart health.
You hope you'll
And there are
never need them,
several levels
but
is a
when the
key
time
step
comes,
towards
having a
maintaining
clear
good
plan
heart health.
changes
And
everything.
there are several
Many
levels
stroke
is a key
survivors who
step
received
towards
help in
maintaining
time
good
credit
heart
their
health.
recovery to
And there
small
are
decisions.
several levels is a key
Keeping the
step
door
towards
unlocked,
maintaining good
having
heart
their
health.
information
And there are
ready,
several
being
levels
somewhere
is a key
visible
step
when help
towards
arrived.
maintaining good
These
heart
things
health.
don't take
And
much
there are
effort,
several levels
but
is
they
a key
multiply
step
your
towards
chances of a
maintaining
better
good heart
outcome.
health.
In
And
the
there are
next section,
several
we'll talk
levels
about
is a
what your
key
body
step
should be
towards
doing while
maintaining
waiting,
good
how to
heart
lie
health.
down, how to
And there are
breathe,
several
and why
levels is a
staying
key
still in the
step
right
towards
position may
maintaining
prevent
good
more
heart
harm
health.
while help is on
And
the
there are
way.
several
Once the
levels
call
is a
for
key
help has
step
been
towards
made and you've done
maintaining good
everything
heart health.
possible to
And
make
there
your
are
home
several
accessible for
levels is a
emergency
key step
responders,
towards maintaining
there's
good
one
heart
more
health.
critical step
And there
that
are
can
several
influence your
levels is a
outcome:
key step
what you
towards
do with your
maintaining
body
good
while
heart
waiting.
health. And
In
there are
those minutes,
several
sometimes
levels is a
long,
key step
sometimes short,
towards
your
maintaining
position,
good
your
heart health.
breathing,
And there are
and your
several
ability to
levels
stay
is a
calm
key
can either
step
protect
towards
you or
maintaining
put you
good
at
heart
further
health.
risk.
And there are
It may
several
feel
levels is a
instinctual to
key
try to
step
move
towards
around,
maintaining good
maybe to
heart
get
health.
more
And there
comfortable
are
or to
several
grab
levels
something you
is a
think you
key
need.
step towards
But during a
maintaining good
stroke,
heart health.
especially if
And
one
there are
side of your
several
body is
levels
weak
is
or
a key
numb,
step towards
movement can
maintaining
actually
good heart
increase
health.
the danger.
And there are several
Falls,
levels
head
is a key
injuries,
step
and
towards
broken
maintaining
bones are
good heart
common
health.
when people
And there are
ignore the subtle
several
loss
levels
of
is a
balance
key
or
step towards
coordination that often
maintaining good
comes with a
heart health.
stroke.
And there are
That's why
several
medical
levels is a
experts,
key step
including
towards
those from the
maintaining
American
good
Stroke
heart health.
Association,
And there are several
recommend
levels
you
is a
stay
key
as
step
still as
towards
possible and
maintaining
find a
good heart
safe
health.
place to lie
And there are
down,
several
but
levels
not
is
just
a
any
key step
position.
towards maintaining
There's one
good
in
heart health.
particular that
And there
helps
are
more than
several
others.
levels is a key
It's
step
called the
towards
recovery
maintaining good
position.
heart health.
Lie on
And
your
there are
side,
several levels is a
ideally the
key
side
step
that
towards
still has
maintaining
strength.
good heart health.
If you're able,
And there are
use a small
several
pillow
levels
or
is a
rolled up
key
towel
step
to
towards
gently raise your
maintaining
head.
good heart
This
health.
slight
And there are
elevation helps
several
keep your
levels is a
airway
key
open
step
and
towards
reduces the
maintaining
risk
good
of
heart
choking.
health. And
Why
there are
does choking
several
matter?
levels is a key
Because
step
during a
towards
stroke, your
maintaining
ability
good
to
heart
swallow
health.
can be
And there are
impaired,
several levels
even
is
if
a
you don't
key
feel
step
it.
towards
If you
maintaining
vomit
good heart
or if
health.
saliva
And there
pools
are
in your mouth,
several levels is a
lying
key
flat
step
on your
towards
back can make it
maintaining
harder
good
to
heart
breathe.
health. And there are
Lying on your
several
side
levels
gives
is a
gravity
key
a
step
chance to
towards
help,
maintaining good
not
heart health.
harm.
And there
It
are
also allows
several levels
emergency
is a key
responders
step
to more
towards
easily
maintaining
check your
good heart
breathing
health.
and monitor
And there
your
are
face and
several
speech
levels
when
is
they
a key
arrive.
step towards
Another critical
maintaining
point:
good heart health.
do not
And there are
eat or drink
several
anything.
levels is a key
Even if you
step
feel
towards
thirsty
maintaining
or think
good
a
heart
snack
health.
might help,
And there are several
resist
levels
the
is a
urge.
key step
Stroke
towards
often
maintaining
affects
good
your
heart
throat
health.
muscles,
And there are
even if
several
you're not
levels is
aware
a
of
key
it.
step
That
towards
makes
maintaining
swallowing
good heart
risky,
health.
and
there are
choking can
several
quickly
levels is a
complicate your
key step
condition.
towards
In
maintaining
addition,
good heart health.
many
And
stroke
there are
treatments
several
cannot be
levels
given
is a
if you've
key
had
step
food
towards
or drink
maintaining
in your
good heart
system
health.
recently.
And there are
So
several
staying on your
levels is a
side
key
with
step
nothing in your
towards
mouth
maintaining good
is
heart
one of the
health.
safest
And there are
things you can do for
several
yourself.
levels is a key
Breathing
step
is
towards
just as
maintaining good
important.
heart health.
Try to
And there are
stay calm
several
and
levels
focus
is a
on
key
slow,
step towards
steady
maintaining
breaths.
good heart health.
Inhale
And
gently
there are
through your
several
nose,
levels is a key
exhale
exhale slowly through your mouth. Deep breathing helps manage fear and keeps your blood pressure from rising further. Panic causes shallow, fast breathing, which may increase the pressure on already sensitive parts of the brain. Many older adults, especially those with high blood pressure or sleep apnea, already deal with restricted airflow during stressful situations. That's why mindful breathing isn't just a mental trick. It's a real medical support during a stroke. If you've practiced breathing exercises in the past, now is the time to use them. Visualize a peaceful moment, a beach, a forest, your garden, anything that helps ground your mind while your body waits for help. And if you feel pain, weakness, or changes in your symptoms, try to stay alert and aware. Note the time if you can. If you're still able to speak, say out loud what you're feeling, even if no one's in the room yet. This can help your brain stay focused, and if you're using a smart speaker or wearable that records audio, these words might later help doctors understand the progression of your stroke. Some seniors worry about doing the wrong thing while waiting, but in truth, the most helpful thing you can do is stay safe, stay still, and stay mentally engaged. Make sure your phone remains close, and that emergency responders can see you easily when they enter. If you're able to move your hand, wave a piece of cloth, or turn on a flashlight to attract attention if your room is hard to spot. If lying on your side isn't possible due to pain or stiffness, at least avoid lying completely flat. Elevating your head slightly, even using a folded blanket, can help maintain blood flow and breathing. And if someone arrives to help you before paramedics, they should be instructed to avoid moving you unless absolutely necessary. Improper movement during a stroke can worsen spinal or muscular damage, particularly in older adults who may already have fragile joints or inflammation in the neck and back. Preparing your body during these minutes isn't about doing something heroic. It's about not making things worse. That's already a win. These quiet moments between calling for help and receiving it are filled with power, if you know what to do with it. And now you do. In the next section, we'll look at one of the most overlooked steps: how documenting your symptoms, either through notes or voice, can give doctors the critical information they need to act fast and treat you effectively once you reach the hospital. It might sound harmless. You feel dizzy, weak, or a little disoriented, and your first instinct is to grab a glass of water, a cracker, maybe even take your daily medication. After all, staying hydrated and fed is usually good for the body, especially as we get older. But during a stroke, this well-meaning habit can become dangerous, even life-threatening. One of the lesser-known but incredibly serious complications during a stroke is the risk of choking. That's because a stroke often affects the muscles responsible for swallowing, even in its early stages. The brain may send unclear signals to the throat, causing food or liquid to go down the wrong pipe and enter the lungs instead of the stomach. This can lead to aspiration pneumonia, which is not only painful but can also delay stroke recovery significantly. For many seniors, especially those who already live with issues like acid reflux, poor digestion, or chronic inflammation in the esophagus, the risk is even higher. Imagine trying to swallow water while your throat muscles are misfiring. What's usually a smooth action becomes clumsy and uncontrolled. You might not even notice at first, but fluid can silently enter the airway. This is called silent aspiration, and it can lead to serious infection and complications after you've already been through the trauma of a stroke. That's why the American Stroke Association and most emergency physicians recommend one very clear rule: do not eat or drink anything once stroke symptoms begin. That includes water, juice, pills, vitamins, or snacks. Nothing should pass your lips until a trained professional has checked your ability to swallow safely. You might feel hungry. You might feel like you just need a sip to clear your head. But when the brain is under attack, even simple things like chewing and swallowing become unsafe. In fact, many hospitals perform a swallow test before allowing any food or drink post-stroke. If you pass the test, you can start with liquids and soft foods. But if not, feeding is delayed until it's safe. And that delay protects your lungs, your throat, and your entire recovery path. Now let's consider another risk. Many seniors take medications in the morning or evening with food. Blood pressure pills, blood thinners, or diabetes medications may be part of your daily routine. But during a stroke, these same pills could become harmful if taken unsupervised. Blood thinners, for example, may worsen a bleeding stroke, something doctors can only determine with a scan. So even though you're just trying to stay on schedule, you could be complicating your treatment plan before you even reach the hospital. This is especially risky if you're on medications like aspirin or anticoagulants, which can interact with stroke treatment protocols. So what should you do instead? First, get comfortable in a safe position, as we discussed earlier, on your side with your head slightly elevated. Focus on slow breathing and staying as calm as possible. Keep keep your airway clear, and avoid any temptation to sip water or take just one bite of something. If you feel dry mouth, which is common during panic or when lying still, gently moisten your lips with a damp cloth or use a lip balm. That can help ease the discomfort without introducing any risk to your throat. And if someone is with you, perhaps a neighbor, friend, or family member, make sure they understand not to offer food or drink either. Many people think they're helping by bringing water or a snack while waiting for an ambulance. But unless they've been trained in stroke response, their kind gesture might actually cause harm. If you've created an emergency folder or note near your door or phone, as discussed earlier, include a clear message. If I show stroke symptoms, do not give me food or drink. This reminder can guide others to do the right thing in a stressful moment. In the bigger picture, avoiding food or drink during a stroke isn't just about safety. It's about giving your brain the best possible chance to recover. Every system in the body relies on oxygen and blood flow to function correctly. A blocked or bleeding artery disrupts that flow, and the brain has to work hard to protect what function it has left. Adding the complication of choking, aspiration, or medication interaction only makes that job harder. Think of it this way: you've already made the call. Help is on the way. Your job now is to do nothing that could interfere with the next steps in your care. It may feel passive, but it's actually one of the most proactive things you can do. And when the medical team arrives, they'll be relieved to know they can focus on stabilizing you, not reversing additional complications. In the next section, we'll look at how to document your stroke symptoms in real time, even if you can't write them down, so doctors have the most accurate information to guide their emergency treatment. When you're experiencing a stroke, especially alone, it can feel like the last thing on your mind is taking notes. But here's what many people don't realize. The single most important piece of information doctors need when you arrive at the hospital is when your symptoms started. Not just sometime this morning or maybe an hour ago, but a clear, specific time down to the minute if possible. Why? Because certain life-saving treatments, like the clot-busting drug TPA, can only be given within a limited time window after symptoms begin, usually around 3 to 4.5 hours. That treatment can dissolve the clot and restore blood flow to the brain, dramatically reducing long-term damage. But it's only approved if doctors know the stroke happened recently. If the timing is uncertain, they might have to skip it just to be safe. That's why tracking your symptoms right from the very first moment gives you a better shot at full recovery. So how do you do that when you're scared, confused, or maybe can't use your hands well? Start by using your voice. If you can speak, say out loud something like, "It's 7:42 a.m. I just noticed my right arm is weak." Even if no one's in the room with you, your phone or smart speaker might capture that audio. And if a friend or paramedic shows up later, they'll hear your words and know when it all began. If you have a smartphone within reach, you can also open the voice recorder or notes app and say what's happening. "My speech is slurred. My left leg feels heavy. I think this started about 5 minutes ago." You don't need to write paragraphs. A few words are enough. For those who keep a journal or notebook near the bed or living room chair, now is the time to use it. If you're still able to write, jot down the time and your symptoms, even if it's messy. Doctors don't expect perfect handwriting. They just want an honest, time-stamped clue about what happened and when. If you're unable to write or speak clearly, try using gestures or drawing simple lines or circles. Some seniors keep a symptom tracker page printed out ahead of time with checkboxes or diagrams of the body. You can quickly mark the affected area or circle the time of day on a clock image. Even this limited input can help doctors distinguish distinguish between different types of stroke. If you live alone and use a smart device or medical alert system, check if it offers automatic time logs. Some systems keep records of when you pressed an emergency button, when you spoke a command, or when your motion sensor stopped detecting normal activity. These digital breadcrumbs are incredibly valuable. They tell a timeline that you may not be able to explain yourself. And don't underestimate the power of preparing in advance. For example, consider creating a basic symptom log sheet, printed and placed in key areas of your home, like the fridge, nightstand, or coffee table. Include sections like time symptoms began, side of body affected, type of problem, speech, movement, vision, etc. Any other sensations, numbness, confusion, dizziness. Even if you never use it, it's there when you or someone helping you needs it most. If you do end up calling 911 and you're able to speak, tell the dispatcher what you're feeling and when it started. If your words are slurred, try to repeat a short sentence slowly. Dispatchers are trained to pick up on signs of stroke from speech patterns alone. If you've lost the ability to speak entirely, stay on the line. Don't hang up. Many dispatch systems use GPS to locate you even if you can't talk. And if you've documented anything, even scribbled on a napkin, emergency crews will bring it with you to the hospital. For older adults managing chronic health issues like diabetes, high blood pressure, or poor circulation, having a log of baseline symptoms can also help. If you already have tingling in your fingers from neuropathy, but suddenly lose grip strength, that change matters. Tracking what's different is often more useful than tracking what's normal. And here's something else. Tracking your symptoms also helps calm your mind. It gives you something to focus on when panic sets in. When you say or write down what you're feeling, you're taking control in a moment that feels out of your hands. That small act, naming what's happening, can keep you alert, engaged, and better prepared to communicate with the medical team when they arrive. You don't have to do it perfectly. You just have to do what you can. The effort to track your stroke symptoms, whether by voice, writing, checklists, or digital tools, is one of the greatest gifts you can give to your doctors, your body, and your future. In the next section, we'll explore something just as vital: learning to spot the early warning signs before a stroke even happens, sometimes days or hours in advance. Most people think of strokes as sudden, out-of-the-blue events that hit without warning. 1 minute you're fine, and the next everything changes. But the truth is, many strokes send warning signs, sometimes hours, sometimes days in advance. These early warnings are often brushed off because they're short-lived or mild. They're called TIAs, or transient ischemic attacks. You may have heard them referred to as mini-strokes. And while the word mini might make them sound harmless, they're anything but. A TIA is a temporary blockage of blood flow to the brain. The symptoms are the same as a full stroke: slurred speech, facial drooping, arm weakness, blurred vision, or dizziness. But they go away on their own within minutes to an hour. That's what makes them so dangerous, because once they're gone, people assume the problem is gone too. But here's what every senior should know. Nearly 1 in 3 people who experience a TIA will go on to have a full stroke, many within just a few days. That means a TIA is not just a red flag. It's an urgent medical emergency and a chance to act before things get worse. The problem is, most TIAs happen when people are at home, alone, or in the middle of doing something ordinary. You might suddenly find your hand can't grip a spoon, or that your words come out jumbled when you're trying to leave a voicemail. You might feel a wave of confusion or get dizzy while getting out of bed. Then, 5 or 10 minutes later, everything seems back to normal. That's the trap. You might think you were just tired, dehydrated, or moving too quickly, but your brain was trying to tell you something. And if you ignore it, the next time, the symptoms might not go away. Many stroke survivors look back and remember these odd episodes. They say, "I felt strange a couple of days before," or "I lost vision in one eye, but but it came back, so I didn't worry. These were early clues, and they matter. TIAs can come with a wide range of signs. A sudden headache that's different from your usual type, a brief inability to move one side of your body, a moment when you couldn't find the right words, or even just a strong sense that something wasn't right. For older adults already dealing with blood pressure issues, poor sleep habits, chronic inflammation, or vascular problems, these episodes should never be ignored. Even if they last just 30 seconds, they're serious. If you suspect you've had a TIA, don't wait for another one to confirm it. See a doctor immediately. There are scans that can look for narrowed arteries or small clots that might be forming. Your doctor might recommend medication adjustments, lifestyle changes, or even simple interventions like hydration or changes to your sleep posture if you have sleep apnea, and that could prevent a full stroke from ever happening. One of the most helpful things you can do is keep a daily log, not just of major symptoms, but even subtle changes. Write down moments of dizziness, confusion, slurred speech, or weakness, and note the time, duration, and what you were doing. Over time, patterns might emerge. Maybe your symptoms happen in the early morning. Maybe they show up after you've skipped a meal or after a stressful phone call. These details can help your doctor better understand your risk and guide treatment. Family members can help too. If you live alone but speak with loved ones regularly, tell them what to listen for. If your speech sounds off or you're repeating yourself, they can help you track patterns and get help faster. Sometimes others notice changes before we do. You might also consider using smartwatches or fitness trackers that log movement and heart activity. Stroke doesn't take away your power, it just means you need to train that power in advance. For seniors who live alone, daily repetition is your strongest protection. Rehearse what you'd say to emergency services. I think I'm having a stroke. I feel numb on one side. My speech is slurred. Please send help. These words, spoken slowly and clearly, can cut through panic and get you the care you need. If you lose speech in an emergency, fall back on practice motions. Unlocking the door, lying safely on your side, holding up a sign if you've prepared one, or waving a flashlight to signal first responders. You might even write a large note and keep it by your door that says, medical info inside. I may not be able to speak. Call 911. All these small preparations can be reviewed monthly on the first day of each month, for example. Set a calendar reminder, stroke safety check. Use that day to refresh your memory, test your devices, check battery levels, and replace anything outdated. Some seniors turn these into wellness days. They do light stretching, drink water, check blood pressure, and then rehearse their stroke reflexes. It becomes a rhythm, not a worry. And here's the truth. Doing these things doesn't just protect your body. It strengthens your confidence. It says, I'm not helpless. I'm prepared. And that feeling of control is powerful. Family members also feel more at ease knowing you've practiced and planned. You're not just hoping to be lucky. You're building safety into your life one small step at a time. Coming up, you'll hear the story of Mary, a woman just like you, who faced a stroke alone and survived because she didn't panic. She acted, she prepared, and her quick thinking made all the difference. Mary had always been an independent woman. At 72, she lived alone in a cozy home on the edge of a small town. Her daughter checked in every other day, and she had a few friendly neighbors, but Mary valued her quiet mornings, her routine, and her freedom. She loved tending to her potted plants, reading novels with a cup of herbal tea, and walking around the block each afternoon. She wasn't on social media, but she did watch health videos from time to time, just enough to stay informed, as she put it. One evening, she came across a video about recognizing stroke signs. Something about the way the narrator spoke made her pay attention. She watched it twice. She even practiced the smile and arm raise test in her hallway mirror, just to see what it felt like. Good to know, she told herself, not thinking she'd ever need it. A week later, at 6:15 in the morning, Mary woke up feeling strange. Her left arm felt heavier than usual, not numb, but uncooperative. She sat up slowly, assuming she had slept on it wrong. But when she swung her legs off the bed, her balance fell off. She stood, reached for her water glass, and it slipped from her hand. That's when she remembered the mirror test. With a calmness she couldn't explain, she walked to the bathroom, looked at herself, and smiled. The right side of her mouth lifted, the left side didn't. A little tremble passed through her chest, not panic, but a knowing. She raised both arms. Her left arm drifted slightly downward. She tried saying a sentence. "I'm feeling okay this morning," she said, but the words were slower than usual, her tongue thick against the roof of her mouth. Mary didn't wait. She picked up her phone and used the emergency shortcut she had just set up 2 days earlier, pressing the side button 5 times on her iPhone. She heard it ringing, and she stayed on the line just like the video had told her. Her voice felt shaky, but she whispered, "Stroke, please help." Then she unlocked her front door and lay down on her side, just like she had practiced. She placed a folded towel under her head, turned on the hallway light, and stayed still, breathing slowly. When the paramedics arrived, they found her exactly where she said she'd be. She couldn't speak clearly by that point, but she handed them a folder that included her medications, her daughter's number, and her medical history. She had placed it on the living room table the week before, just in case. At the hospital, the doctors confirmed she had suffered an ischemic stroke, a clot blocking a small vessel in her brain. But because she had acted so quickly, she was still well within the window for TPA treatment. They administered the medication immediately. Within 24 hours, Mary's speech began to return. Her arm strength improved. She was transferred to a rehabilitation unit where she began physical and speech therapy. Her recovery wasn't easy, but it was full. Within 3 weeks, Mary was walking unassisted again. She could hold a cup of tea without spilling. She could call her daughter and have a full conversation. She could smile fully. When asked later what she thought saved her, she didn't hesitate. "I didn't wait. I recognized it and I had a plan." That's the power of preparation. Mary wasn't lucky. She was ready. She didn't tell herself it was nothing. She didn't lie down and hope it would pass. She used what she had practiced, and because of that, her story didn't end in tragedy. It became a lesson in resilience. Her story is not unique. Every day, seniors across the country experience similar events. Some don't recognize the signs in time. Others do, but hesitate. But those like Mary, who pay attention to the early symptoms, who prepare their homes, their technology, their habits, they give themselves a better shot. A stroke doesn't have to steal your independence. It doesn't have to take your voice, your movement, or your future. But surviving it and recovering well depends on how quickly you respond. And that response comes easier when you've already rehearsed it. Mary's story is here to remind you that it's possible. That being alone doesn't mean being helpless. That knowledge really is power, especially when it's turned into action. So ask yourself today, what have you done to prepare? What small habits can you build just like Mary did that might one day make all the difference? Because the tools are here. The information is in your hands. And the next time your body whispers that something's wrong, you'll know how to listen. You'll know what to do. And you won't wait. In the quiet space we've shared today, we've talked about something that often goes unnoticed until it's too late, what it means to face a stroke alone. And yet, what you've just walked through wasn't just information. It was preparation. It was clarity. It was a kind of permission to slow down, to notice, to listen to your own body a little more closely. Because the truth is, you don't need to be surrounded by people to be protected. You just need to be present, aware, and a little bit ready. And readiness doesn't look like fear. It looks like keeping your phone nearby, like practicing a small smile in the mirror each morning, like knowing where your keys and medical papers are, and gently rehearsing a sentence out loud, even when the house is still. Maybe tomorrow, when you make your healthy breakfast or brew that cup of herbal tea, you'll feel something different. Not anxiety, but quiet confidence. A sense that if something ever does go wrong, you've already laid down the first stepping stones toward health. You've already cleared the path for someone to find you, understand you, treat you, and maybe, just maybe, you've shared a little of this with someone you love so they too feel that same steady ground under their feet. We can't always control what happens to our bodies, but we can shape how we respond. And sometimes that response begins in the smallest ways. In the routine of a gentle morning stretch, the familiar warmth of sunlight through the curtains, the sound of your own voice saying, "I'm okay," because in those quiet, ordinary moments, you've already begun to build something strong. A life where even when alone, you are never truly unprepared. That's the kind of strength that doesn't shout, it whispers. It steadies the breath, turns worry into awareness, and it reminds you, as the day winds down, that being safe, being calm, and being here is more than enough.